So if you understand these two pictures, you understand everything you need to really figure out what's going on your physical exam. So we're going to start with this big fancy one here. And across this axis, the x-axis is time, right? So this is the first heart sound, second heart sound, first heart sound, second heart sound. The first thing that happens during the cardiac cycle, and of course we can start anywhere, but let's start with the QRS complex. The QRS complex of the EKG is essentially ventricular contraction. And during ventricular contraction, the aortic valve close, or the AV valves close, right? The mitral and tricuspid valves close. And as the ventricular contraction continues, the pressure inside the ventricle continues to increase. That's the red line that we're looking at here. As that pressure increases, eventually the pressure in the ventricle will exceed the pressure in the aorta, and that makes the aortic valve open. Okay. Now the pressure in the ventricle continues to increase, and it forces blood out of the ventricle into the aorta until such time as the aortic valve closes. And that begins this period of isovolumic relaxation, where the pressure in the aorta is higher than the pressure in the ventricle until the AV valves close. The AV valves open, forcing the blood from the atria into the ventricles passively. Passively. The only reason the blood flows into the ventricle is because the pressure in the atria is greater than the pressure in the ventricles. And that's why the mitral and tricuspid valves have opened. Okay? You can see the pressure gradient is not that big, right? This is the pressure in the atria, this dotted line. The red is the pressure in the ventricle. So there's not a great gradient there. There's not a big difference. Then the whole process starts all over again. But the important things to remember here are S1 forms by closure of the mitral and tricuspid valves. AV here stands for atrioventricular valves. That's the mitral and the tricuspid. Okay, mitral valve closes slightly earlier than the tricuspid valve because the depolarization of the ventricle, of the left ventricle, happens before the right. And then there's this period of isovolumic contraction. And once the pressure in the ventricle becomes higher than the pressure in the aorta, the aortic valve opens. That's really important to understand when we're talking about differentiating AS from MR, or aortic stenosis from mitral regurgitation. All right, but let's keep going. When the aortic valve closes, that's the second heart sound. Okay? Now, when there's passive ventricular filling from the atria, it's because the pressure in the atria is higher than the pressure in the ventricles. But if there's a ton of blood in there, like a huge volume of blood, that makes a sound when it goes in. We call that the third heart sound, or an S3. Okay? And then if atrial contraction happens and the blood is ejected into a non-compliant, real stiff, thick heart, then it makes a sound also. And it's not pictured here, but right here is where we see the fourth heart sound. It's a pre-systolic sound, happens during diastole, but right before systole. And that is the sound of blood emptying from the atrium into the ventricle. It makes a sound. We call that the fourth heart sound. Okay? Good. So listen to that a couple times. Understand all those little tidbits that I gave you, because once you get that sunk into your head, all of these physical exam findings are going to make total sense to you. Okay? Now, over on this side, it's important to look at the pressures. Know that the pressures on the right side of the heart are much, much lower than the pressures on the left side of the heart. So the pressures on the right side in the right atrium are 0, essentially the central venous pressure is nothing. Okay? So the right atrial pressure is the central venous pressure, and that pressure is 0 to 4-ish, something around there. Now, all of you critical care nurses and heart surgery ICUs, you're probably thinking, well, the right atrial pressure is less than 15, I'm happy. Well, okay, but in a normal heart that's not in your ICU, a normal right atrial pressure is nothing, all right, or next to nothing. When the pressure in the right atrium exceeds the pressure in the ventricle, then the pressure gradient opens up this valve, and now the right ventricular pressure is about 4, 0 to 4, somewhere around there. And that 4 now in diastole becomes 25 when the ventricle contracts, and that sends it out through the pulmonic valve to the pulmonary artery. Again, the peak pressure here is 25 or so, but now when the valve closes, the diastolic, instead of being 4 or nothing, is going to be 10. That's important. Keep that number in mind. 10 is the pulmonary artery diastolic pressure. Now the blood goes to the lungs and gets oxygenated and dumps off all of its CO2 and goes to the left atrium. And now we have all of this left atrial blood coming in here. Look what the pressure is. It's 10, right? The left atrial pressure is the same as the pulmonary artery pressure, both 10. Now the mitral valve opens and the blood dumps into the left ventricle. Look what the pressure in diastole is. It's 10. Check it out. The pulmonary artery diastolic pressure is about the same as the left atrial pressure, which is about the same as the number one most important pressure indicating the preload on the heart, the left ventricular end diastolic pressure. They're all the same. Okay? Then the blood pumps out through from the left ventricle through the aortic valve into the systemic circulation. So what's the pressure there? It's the systemic pressure, right? 120/80, hopefully. And hopefully you learn that the ideal blood pressure is less than 120/less than 80 in people who are under 70 or so.